Welcome back to the show. Today we want to highlight a simple blood test used to screen for multiple cancers before they become symptomatic. We're joined live this morning by Dr. Candace Westgate to talk about the importance of recommended screenings and why early detection is so important. Good morning. Thanks for joining us.
Good morning. Thanks for having me.
Yes, Dr. Westgate, tell us about this new screening tool and why it is needed.
The new screening tool is a simple blood test that can screen one individual for multiple cancers at the same time. Currently, we have single organ screenings, and there are 5 of them that are recommended by societal guidelines. However, 70% of cancer deaths in the United States are caused by cancers that we do not have cancer screening tests for. So this test is a proactive screening test indicated for those individuals over the age of 50 or at higher risk of developing cancer. And we're really excited about the impact this is going to have for patients, for early detection and to improve survival and outcomes.
Yes, it sounds like an improvement here. Is this test something that anyone can use?
Currently, it's recommended for those individuals who had elevated risk of cancer. So, for example, being over the age of 50 or having a strong family history or environmental exposures or many other factors. So I recommend all my patients talk to their providers about their cancer risk, individualize their cancer risk, assess it, know what their risk is so that they can then excuse me, a bit tongue-tied this morning. I need more coffee. They can then preemptively get ahead of cancer, making sure that they're up to date on all of their cancer screenings that are recommended right now by societal guidelines, but then to consider other tests like this multi-cancer early detection blood test that can screen for multiple cancers with one simple blood draw.
Helpful information there. And what happens after a patient takes a test?
The blood sample is then sent to the lab where it is analyzed. The test results are then received in about 14 days by both the patient and the provider, and a recommended follow-up visit to discuss the test results would be the next step. There are 2 results that come from a test like this: cancer signal detected and cancer signal not detected. If a cancer signal not detected comes back, this is reassuring, but important to know that this test is not 100%. It doesn't screen for all cancers, as some cancers we cannot find by looking in a blood sample. So it's very important that patients continue with their current cancer screening recommendations like the mammogram, pap smear, colon cancer screening, etc. For those individuals who do get a cancer signal detected, remember this is a screening tool. And so the next steps would be a thorough diagnostic evaluation to better assess if cancer is present or not. This test for us as providers provides us with a very unique cancer fingerprint. Not only are there cancer cells that were found in that blood sample, but where is that cancer signal coming from? What organ or what tissue should we then go and look at for our diagnostic evaluation?
Yes, it sounds like another helpful tool here. Fortunately, we're short on time, have to let you go. Where can our viewers go for more information?
I would recommend patients go to the website gallery.com. There's a significant amount of information for their patients, handouts that they can print out to give to their providers. And there's also a significant amount of information for providers who are interested in learning more about this test.
All right. Thank you so much for your insight. We appreciate your time this morning.